Welcome to another episode of Winning Healthcare Food Fights Without the Mess. I'm Hunter Schultz, and this time, the 2020 Healthcare Buyer's Guide. I was having a conversation last week with a friend of mine who had no idea what to look for. He was telling me that he didn't have a clue. He didn't know, other than what he spends on his healthcare, which seems to be going up and up and up. And I thought, what a fabulous idea. Let's do a buyer's guide. So in 4 episodes, we'll explore what to look for in the plans that are being offered. So you're going to know the attributes, benchmarks in which to evaluate and compare. And by the time you're done, you're going to know exactly what to look for. When you start researching proposed health plans, one of the things you're going to do is naturally read it. You're going to go to a website, you can open up the plan, it'll either be on the site or it'll be a PDF file, Adobe Acrobat file. Well, now you're looking at something that could be many pages long. And then, what do I look for? Well, that's where you do a Control F if you're on a PC or a Command F if you're on a Mac. In the search dialog box, you will enter certain search terms, which you're going to learn from this buyer's guide. And if you don't find it in there, something is wrong. Something isn't right. They haven't addressed the issue. And if they don't address the issue, critical issues, there's a good bet that the plan is flawed. It doesn't matter how much money you spend. It doesn't matter if it's free. You got to get it right. We have an election coming up, so there's a lot of pent-up emotions and there's a lot of angst going on right now. There's a lot of fear, uncertainty, and doubt, too. As I observe conversations, as I participate in them, both online and in person, I sense obviously a lot of frustration because people don't understand what's going on. Then we have single payer, universal coverage, Medicare for all. They get a lot of eyeballs. And why is that? Well, sky-high bills are scary. That makes sense. But most people don't need expensive care. 80% of our care is primary. Those who do have problems, a lot of them are chronic care, and a lot of those problems are preventable if you have the right kind of primary care. That is one of the critical attributes you need to look for in any proposed healthcare solution. I'll give you an example of this. Super users are essentially chronic care patients, multiple problems. I mean, we're talking chronic pain, heart disease, diabetes, kidney and liver diseases, respiratory diseases, addiction. Those patients drive a lot of the ER visits, and they're super users of ERs, emergency departments. And furthering that, you have mental illness and homelessness or substance abuse problems that will further exacerbate and make that situation more expensive. Overuse of ERs. Frequent users of inpatient care tend to be older, sicker, and they have more complex and complicated conditions, and they have insurance. So they spend more time in the hospital, and that costs a lot of money too. 5% of our population drives about half of our healthcare costs. And one of the interesting things you can do is go do a little research. We'll have some links in the show notes. There are a couple of things that stand out, and it reinforces the point about what I said just a minute or two ago about primary care. Super users often lack the support to coordinate their care after they're released from the ER or the hospital. One of the standout problems is many don't have a primary care doctor that can provide ongoing coordinated focal point for care. And I covered that a little bit with Dr. Aimee Ostick in a previous episode.
There's so much behind the scenes that as a primary doctor we really should be doing, and that's really calling specialists, making sure people, I mean, as in the office as well, my nurse helps with this too, making sure the patients show up for their appointments and then getting those notes, and so that we can review the notes. There's a lot of, I like the coordination for me is talking to family members too, so when I talk to a patient, sometimes I'm getting a third of the story. And so I'll get their permission. Is it okay if I call your husband, or is it okay if I call this friend that was there with you at that time, and I get their permission, and then I get so much more context. And, so I think that coordination, and a specialist coordination with any procedures that you may order to make sure patients know where they're going, and what their instructions are meant to do. And then also just the context, the psychosocial context to their care. Getting the kind of it gives you so much more a broader scope of what the patient's dealing with, what they're going through. And you don't, because your job isn't done when they leave. There's so much more behind the scenes that you need to kind of fill in the gaps and make sure that things, that the orders will get executed, that they'll do what they're meant to do, et cetera, and that they understand what they're supposed to do at the end of the day too.
So there's no focal point for care. I always ask in a lot of these stories I read in the news and online, where's primary care in all this? So that's a big clue of what to look for in any proposed plan. And if you're going to a town hall and you're going to ask some questions, Senator, Congresswoman, how is your plan going to fix and get primary care right? Which is a good question. The thing is, you have to know what the right answers are. And there are a few good answers to that question. And the big clue to look for in any proposed plan is comprehensive primary care. Part 1 of the guide is going to focus on coverage doesn't equal care, and what kind of care are we talking about? There are 3 different types of care, and we're going to focus on those so you have a better understanding of where things fit. And we'll also explore a little bit about coverage, paying for care. While Part 2 will cover accessing care and the focal point for care. Part 3, time with the patient and thinking time. Part 4 will be the personalization of medicine and how it's directly related to privacy. Again, check out the links in the description. And also want to let you know that we're making some upgrades to the show, including a Patreon page with exclusive content and bonus time with the guests. So those will be for subscribers only, along with some special things that you'll be able to access, and we're quite excited about that. The other thing we're going to be doing is video. Scary as that might be for me, I think it'll be fun. It'll be a lot more interactive. It'll be more YouTube friendly. I understand that. So thanks again for listening, and until next time, there you are. Thanks for listening to the Winning Healthcare Food Fight Show. Hit the subscribe button to hear more expert thinking on getting better care without the mess.